questions, you may ask them and type in the chat box. So we will answer questions during the Q&A session. Now, if you're watching via Facebook Live, kindly send your questions through the comment section of the video stream. Thank you so much, and let's enjoy the knowledge sharing. But before we proceed in introducing our lecturer, may we hear a few words from our esteemed department chair, Dr. Joylan Magbanwa, for the welcome remarks.
Good afternoon, everybody. Okay, I would like to greet each and every one listening via Zoom and via Facebook Live. Would like to welcome you for in our discussion about cervical cancer. Beware, be aware, and don't fear. So may we be able to impart knowledge to our layman and as well as our colleagues. So let's enjoy the evening and let's listen to our esteemed speaker. So enjoy our lecture.
Thank you very much, Dr. Magbanwa, for the welcome remarks. Today, as mentioned, we are very lucky to have Dr. Reya Hurtado, a gynecologic oncologist, to discuss about our topic. I've known her since we were in training. She had her medical degree at UP College of Medicine and proceeded with her residency training as well as fellowship training at Philippine General Hospital. Her work ethics is just superb, and her surgical techniques are likewise commendable. Without further ado, let us all welcome Dr. Reya Andrea Hurtado, our lecturer for tonight's webinar.
Thank you. So again, good evening, everyone. Thank you, Dr. Arcadis, for the kind introduction. Tonight, my goal is to let you all know that cervical cancer is a preventable disease. And women having or getting cervical cancer can be reduced with exerted efforts on prevention and screening. So I'll begin my lecture or my topic with two cases or two stories of my two patients that I've seen. And I wanted to emphasize that cervical cancer can occur at any stage of a woman's life, especially those who have risk factors. So my first patient is a 33-year-old single and works as a call center agent and has a 1-year history of vaginal bleeding, which she did not consult. And then 2 weeks prior to consult, she came in for dizziness. And upon assessment, there's noted cervical mass measuring 7 revealing a squamous cell carcinoma non-keratinizing. For this patient, we are still recorded, married, and has 5 children and a housewife. Also with 1-year history of watery, foul-smelling discharge, but no consult done. She had 6 months of spot and 1-week history of profuse vaginal bleeding, which prompted consult. On assessment, there was already cervical mass measuring 4 by 5 cm, and biopsy also revealed a squamous cell carcinoma keratinizing. However, for this patient, she was lost to follow-up, and when she came back, she said she took herbal medicine. What is pertinent for these cases, even if there were already symptoms, it took a long time to seek consult, and already consulted when they have the severe symptoms and when they are already experiencing vaginal bleeding. So for these two patients, when they went to my clinic, the first thing that they would ask would be, Doc, ano bang cervical cancer, or what is cervical cancer? So what is cervical cancer? So cervical cancer is cancer in the cervix uteri. It is a cancer in the part of the uterus. That's where we call the cervix. So that's where the cancer is. So ito ay cancer sa cuello ng matres. When I expound on this for my patients, for them to understand fully, so I will just tell them the kung saan yung bahay bata, may kwelyo ang matres doon nagkakaroon ng cancer. So the pictures seen below are as you can see, this is from at the leftmost side of the picture is a normal looking cervix. And then right beside it, to the right, is already a cervical cancer, but at its early stage. And then to the furthermost right is cervical cancer progressing or in a higher stage. So this kind of cancer, this friable mass, actually this causes the vaginal bleeding. And then after explaining what is cervical cancer, they will ask, paano ko po nakuha to, Doc? Paano po nagkakaroon ng cervical cancer? So how do we get cervical cancer? So the main culprit would be your human papilloma virus. So your human papilloma virus is a virus that can be passed between people through skin-to-skin contact. It can be passed through sexual contact. It can be passed through fomites. We have 100 HPV types, but there are only types of HPV or the high-risk types that can cause the cancer. And the common will be your HPV 16 and 18. So human papilloma virus is like a virus. It's like a flu virus. So when you get the disease or when you get this virus, it's actually it sometimes it resolves or sometimes you clear off the virus like the influenza. So what causes this virus to develop into cervical cancer? So actually the persistence of this virus in your cervix causes the development of cervical cancer. So what are your risk factors of developing or having this cervical cancer if the virus can be cleared off? So who are at risk of getting cervical cancer? So these are your risk factors. So the main risk factor for getting cervical cancer is having the HPV exposure or having the HPV infection. And then you have multiple sexual partners. You have early coital or you started sexual debut at an early age, or you delivered also at an early age. Those who smoke, those who have delivered more than 3 times, prolonged use of OCP, and those who have no screening or those who do not screen for cervical cancer actually is a risk factor. So I will be discussing on the natural history of cervical cancer. As I've mentioned before, the human papilloma virus, which is the main culprit for developing cervical cancer, actually clears off or resolves. So how does it persist, or how does it progress into cervical cancer? So this slide only shows you that when you have a normal cervix and then you have an exposure to the HPV virus, which is you have multiple sexual partners, early sexual debut, high parity. When you get the human papilloma virus, and then when this virus persists, and it persists because you have the high-risk HPV infection, or you got the high-risk type of HPV, which is the HPV 16 and 18 that causes the cancer, you have a weak immune response, you have other STDs, or you are genetically, or your genes are programmed to develop cancer. And then after being infected with an HPV, as it persists, you develop the pre-malignant lesions, which is the low-grade squamous lesions, and the high-grade squamous lesions. As you can see in this slide, it will take time for these pre-malignant lesions to develop before progressing to cervical cancer. So actually, that's why cervical cancer is preventable. There's a lot of intervention that we can do during the progression or during the persistent infection of the high-risk HPV into development into cancer. So what are the common symptoms of cervical cancer? So you have, as I mentioned with my two patients, the foul-smelling watery discharge or any abnormal discharge. You have your spotting, intermittent spotting, postcoital spotting. You have vaginal bleeding and low back pain. Cervical cancer is the second most common cancer in women living in low and middle income countries. So in the Philippines, every year there's an estimated 7,277 new cases, and almost half of these new cases die in a year due to cervical cancer. So around 2 women dies of cervical cancer every minute. If cervical cancer is the second most common cancer, the, the first or the most common cancer would be your breast cancer. What's very with breast cancer, what I wanted to share was that for breast cancer kasi, we can do manual breast examination. It's easy for the girls or for the women to do manual breast examination. So that's already a part of screening. But then for cervical cancer, you need to see a center or a clinic to have your cervix be assessed. So that's maybe one of the barrier why there is little or there's actually women don't do screening for cervical cancer. So WHO, DOH, and also NGOs have this goal by 2030. 2030 so as a part of cervical cancer elimination by 2030. And this is their three strategic pillars. So we have our prevention through vaccination, which is HPV vaccination offers long-term protection against cervical cancer. And their goal is that 90% of girls fully vaccinated with HPV vaccine by age 15 years, by age before 15 years old. And then the second one will be screening and treatment of precancerous lesions to prevent precancer from developing into cancer. And their goal by 2030 is that 70% of women are screened with a high performance test. High performance test meaning, I'll discuss it later. It's HPV DNA testing by 35 years of age, again, and by 45 years of age. So in a woman's lifetime, she should have received screening for cervical cancer 2 times. And then timely treatment and palliative care for invasive cervical cancer. So which can save lives, and palliative care can greatly reduce pain and suffering. So 90% of women identified with cervical disease should receive treatment, and 90% of women with precancer should be treated, and 90% of women with invasive cancer should be managed. So that's our goal for the elimination of cervical cancer. So I'll go to the prevention. So primary prevention. So I listed 4 primary prevention. So the number 1 would be total abstinence, which prevents HPV infection. Lifetime mutual monogamy prevents HPV infection. And then consistent and correct use of barrier protection decreases cervical cancer incidence. And then vaccinations against HPV 16 and 18 is efficacious against persistent HPV infection and a precancerous lesion of CIN2 or your high grade or low grade squamous intraepithelial lesion. What I'd like to point out is the fourth one, the vaccination against HPV 16 and 18. So HPV vaccination can prevent 90% of HPV cancer. And through studies, HPV vaccination has decreased the HPV infection causing HPV cancers among teens by 71%. And the 2 doses is effective as three doses if given before the 15th birthday. So what are your type of HPV vaccine? So your HPV vaccines can be given at an age as early as 9 up to 26 years. Why only up to 26 years? Because the study only have shown that at 20, given 26 years, the efficacy of the vaccine is up to 90%. So for the Cervarix, it's given to girls 9 to 26 years of age, which is your HPV type 16 and 18, which is the high risk type of cancer, which can cause cancer, is given at 3 doses. However, I think Cervarix now is not available. And then we have your Gardasil and your Gardasil 9, which is the recently introduced HPV vaccine. So your Gardasil would include your HPV 16 and 18, which is your high-risk type of human papillomavirus, and will also include the 6 and 11, which is the low-risk type, which only cause the genital wart. And then for the Gardasil 9, it's 9 because it targets 9 types of HPV. So it targets 7 of the HPV types that can cause cancer. Aside from the 16 and 18, it includes 5 more HPV types which we see now that in the Philippines there are HPV types 45, 33 that can cause cervical cancer. And then also included is the low-risk type or the type 6 or 11. So these are given at 9 to 26 years old. So if given before the Gardasil and the Gardasil 9, if given before 15 years old, you can only give 2 doses. So for the secondary prevention, regular screening through pap smear. So if we did not catch the primary prevention or we did not receive the vaccination, we go to the secondary prevention. So that's regular screening through pap smear. So pap smear is actually getting a sample of cells in your cervix, and the pap smear, when under the microscope, can detect abnormal cells in your cervix that can diagnose if you have precancerous lesions such as low-grade squamous intraepithelial lesion or your high-grade squamous intraepithelial lesion, which you can be treated for this, which in the end can prevent progression to cervical cancer. So this is your secondary prevention, your regular screening through pap smear. So for WHO, the age to start screening is at 30 years old. However, the ASCCP or the American guidelines that the Philippines that we the society follows, we start screening at 25 years old if there is already a sexual debut. The next would be your visual inspection with acetic acid. Some centers or some clinic don't have or doesn't have the capability of doing pap smear because you need a microscope, you need a pathologist to check the cells. So DOH and some NGO have trained midwives, nurses to man the centers, the health centers, or small clinics to do visual inspection with acetic acid. So what we do here is that a vinegar or suka, your common household vinegar suka, and then when you use a speculum, and then when you see the cervix, you put suka or you put vinegar for around 60 seconds or for 1 minute for the suka to take effect. And then after that, after removing the the cotton ledger that has suka. If there's an abnormality, you would see a white lesion. It means that there's an uh, abnormal proteins that are occurring there. So that's why you have whitish coagulation. So that's abnormal. And then if the center or the clinic is trained to do treatment with VIA, they can actually give the cryotherapy or the treatment for that. And then after that, if it's treated, and then they reassess again after a few months. If not, if the center is not capable of giving the treatment, they can actually refer to a hospital or a center where they can do, or where they can assess more. They can do colposcopy or a more extended visualization of the cervix to assess the abnormality that they saw during the visual inspection with acetic acid. And then we'll go to the HPV DNA testing. This is actually the first choice or the first choice screening method to screen cervical cancer. However, for our country, it's not yet available. It's it needs a special machine or a special a PCR machine to detect the HPV DNA. So only a few labs. Sometimes it's also not available in big hospitals. The HPV DNA testing, we have to send it out to a laboratory. But the collection is the same as the pap smear. You just get a sample of the cells in the pap smear and then you subject it to a PCR. So what's the advantage of this HPV DNA testing is that we can actually tell if you have the HPV, what HPV infection you have. If for example, when you do the HPV DNA testing, we get results that you are positive for the high risk type 16, 18, 33, or 42, then we can actually advise the patient or the patient to get treatment. It depends kasi there's a triaging also for HPV DNA testing, or to seek consult to a specialist. So and the patient is aware that she is infected with a high risk type of HPV or the human papilloma virus that can cause cervical cancer. So with this, the primary prevention, the secondary prevention, the HPV vaccination, the screening that I have told you can actually prevent cervical cancer. So cervical cancer is a disease that can be prevented through HPV vaccination and regular screening. Or ang cervical cancer ay sakit na maaring maiwasan sa pamamagitan ng HPV vaccine at regular na screening. I think this is my last slide, and the message that I want to impart to you is that get informed, get screened, and get vaccinated. Thank you very much, everyone, for listening.
Thank you very much, Dr. Hurtado, for that informative lecture. It's short, it's sweet, and it's very malaman, so to speak. You were able to cover the basics, but there are some questions posed by some of our listeners. First, is there a certain cutoff in terms of length of OCP use, which poses a greater risk in developing cervical cancer?
There's actually no certain length, but what in the studies, more than 10 years use of OCP is actually a risk factor in developing cervical cancer. The hormonal the reason for this is because the hormones can actually modulate the HPV infection to incorporate or to develop to let it develop into cervical cancer.
Okay. Sige. Doctora, I have another question. But before we go to that question, let me just flash this because apparently we have the cancer screening package. So it's just an advertisement in the
Yes.
middle of the Q&A. So we have the cancer screening package wherein pap smear is already included, CA125, for other
For
cancers
our
such as
ovarian.
ovarian new growth, yes. Whole abdominal ultrasound and breast ultrasound. So this is available in QualiMed Santa Rosa for only 6,170 pesos. And I think that's already a bargain in order to get checked and see if there's any problem. Um, moving forward, we have other questions. Okay. Um, first, second question na pala to, Doctora. How do you explain patients who get cervical cancer without any sexual intercourse? Because you mentioned earlier that HPV is the risk factor, the major risk factor in developing cervical cancer. But there are stories wherein some patients would get cervical cancer and then there was no history of coitus.
Yes. Actually, marami akong patients na ganyan. They would come to me, Doc, wala akong coitus, wala akong sexual contact, so paano ko siya nakuha? There's things such as skin-to-skin contact, warm mite. So when I ask them, especially patients who are LGBTQ, so sila yun eh. And then I would ask, ilan ba naging partners mo? And then they would say 5 to 6, but no sexual contact. But through fomite, through exchange of by just doing skin to skin contact, prolonged skin to skin contact, you can actually transmit the virus. So no need for actually the act or the sexual contact. So if there's a prolonged skin contact, the virus can be transmitted.
Para skin to skin contact, you mean to say even holding hands? Or well, of course it's in the organ. So definitely
Yes.
not necessarily penetrative using any
Mhm.
instrument or
Not
or
necessarily
toy.
penetrative, but the skin contact of the genital area or around that area can actually transmit the virus. Even with using the hands, basta there's
Okay,
skin contact.
I think that's a good to not good to know, but I think that's an information that should be shared to many people because many would have that notion that once you have cervical cancer, it's because you've been with a polygamous partner or the patient's been polygamous herself, diba? Parang there's this certain type of stigma. So apparently you can have it even without actual sexual contact, but skin to
Yes.
skin contact, such as and fomites, no, can transmit HPV. Okay, I have another question, Doctora. How about cervical cancer vaccination? You mentioned that a while ago. Are you aware of any programs by in the Philippines wherein giving HPV vaccination is encouraged in younger population? Because you mentioned, and I'd like to emphasize din in your lecture, it can be given to patients as young as younger than 15
9.
years old, right? And they get
Yes.
2 doses only, tama? Compared to adults na 3 doses.
Mm-hmm. Okay.
Is there
Yes.
any program by the government or program that you know of that encourages vaccination, HPV vaccination?
Um, Actually, the program before for the HPV vaccination for girls, however, this was discontinued and was not supported because
Sorry, Doctora, medyo choppy lang po.
there are
Can
many issues, especially Yes, it's better now. Sorry.
And better. Okay.
There was a misunderstanding that or parang the sexual consciousness of the teenagers or the younger population would be with the
Sorry,
HPV vaccination.
okay. Sorry, I didn't catch the last few words that you
Yeah,
mentioned.
it
I'm not
really
sure if it's my connection or
so I think baka connection ko. Sorry, I'll just repeat it. So may misunderstanding between the schools and the giving of the HPV vaccination. Na-stop siya eh. Kasi may misunderstanding na parang the sexual consciousness or yung parang mas na-aware with the sexual ano yung mga bata is parang na-associate siya with HPV vaccination, parang pinoprod pa natin sila. Parang yun yung dumating eh. Parang pinoprod natin sila magkaroon na mag engage to sexuality mas maaga. But what the HPV vaccination actually wants is kasi when we grow old, when you can't control kasi the environment, you can't control your children, you can't control who are they gonna marry, what are they gonna do when they grow up, but giving them the vaccine, the HPV vaccination actually protects them from this very dreadful disease. As I've said, I've seen younger patients now, dati noon 50, 40, but now I see 24, 25, 26 years old having cervical cancer. And what's sad for these patients are they are because they're young, they're supposed to clear off the virus. As I've said, it can be cleared off. But then why did they? Kasi bata nga sila, ba't hindi nila na-clear off yung virus? Maybe the type of cervical cancer they have are the higher or the mas mas aggressive type. So that's why it was immune system. So actually sila yung mas mahirap gamutin, sila yung nagtutumor progression, sila yung hindi nagre-respond with the treatment, the radiation. So it's very sad. So now that may vaccination naman, sana we can give the vaccination to our girls, our teens to prevent cervical cancer.
thank you very much, Dr. Hurtado, for that. Actually, it's a good thing to emphasize if there are pediatricians here listening, or if we have parents
Yes.
who have listened to your lecture. I think it's good to promote HPV vaccination because, as you've mentioned, Doctor, we cannot really we cannot really control their actions, our kids' actions. But then again, the least that a parent could do is to protect um, the daughter or the son. Okay? So
Yes.
it's not just for women, by the way. Diba, Doktora? Tama ba?
Yes. Pwede sa boys. Yes.
It's for females and males. So
And
it's
males.
not just the girls would be given vaccination. So everyone is encouraged to have HPV vaccination. We have another question, Doctora. Is it okay to have multiple doses of the vaccine? So example, if a patient had already received Cervarix, let's say 10 years ago, and now she wants to get Gardasil 9, would that be okay?
Wala, I think it would be okay to receive the vaccine. But yun nga, the studies for Gardasil for the if for parang the high efficacy of this vaccine is at 9 to 26 years old. But there's nothing wrong or there's nothing harm if you get the vaccination, the Gardasil 9.
Okay. So for those who've been given Cervarix before or Gardasil, the quadrivalent vaccine before, they could
Yes, they
still get the
can
Gardasil
get
9.
that.
So
Yes.
can you give us a ballpark amount? How much is Gardasil 9? For I
Oh,
think it's the best one available right now, no?
yes, the Gardasil 9, because it has the seven types of HPV. That dati nun kasi it's 16 and 18 lang. But when
Mm.
with the advent of the HPV DNA testing, we see now 42, the 33. So it's actually good to get the HPV. I don't know. Um, the it's around, I think, around 8,000 to 10,000. I'm not sure kung ano yung
It's
SRP
quite
niya eh.
scarce. It's quite difficult to source. There was a time I think in 2020 that it was out of stock. 2019, 2020, I found it difficult to get stocks of Gardasil 9. Sige. We have another question, Dr. Once once a patient is or once a person has been given the 3 doses of HPV vaccine, is there still a need to give the fourth dose or a booster dose?
No, the recommendation is only for 3 doses lang. So if you got that 3 doses, it's okay with
Okay.
the proper timing. So 0, 2, and 6 months.
Okay. So we have a feedback here. The range of Gardasil 9 in some pharmacies around 8 to 9,000
Yeah, I
per
think that's
dose or
nga.
per shot, around that range. Since cervical cancer is mostly associated with STI, do you think it is prudent to have the partner checked as well for HPV DNA?
Yes, pwede. Pero it's more efficient, or it's more, what, parang mas, paano ba natin, efficient kung yung babae yung
Cost
mag-HPV DNA. Mas
effective
cost
or
effective, yes. Yes, cost
mm,
effective if it's the female. But you can screen males for the HPV DNA testing. Kaya lang kasi, as I've told you, HPV DNA HPV can resolve eh. So, pwedeng meron siya this time, after ilang months, wala na yung virus. Kasi you can clear off the virus. Eh. Yun nga yung problem with the female, the women. We have the tendency to retain the virus, and the persistence of it can cause nga cervical cancer.
so I think better yet have the partner vaccinated with HPV vaccine na lang, no? To be protected. Well,
Pwede, mas
ideally, it
maganda
should be
yun.
before.
Yes.
So they could bring. So do you have instances
Sexual
wherein,
debut. Yeah, that's
yeah, was there any instance in your practice that your patient brings her partner for vaccination?
di na. Kasi usually when I see them, they're
Ayaw,
already
that's already the,
they
they're
already
already,
have cervical. What I
mm,
see, kumare, I have patients like cervical cancer. What I see are yung mga anak nila, they bring for the vaccination. So they get, syempre, traumatized with the cervical cancer. Yung mommy nila may cervical cancer. So, ang nakukuha ko sa clinic is their daughters. Yung pinapa-vaccine nila. So, yun nga, it's sad kasi nga, they only get the vaccine when, pag alam na nila yung sakit. But the HPV, yun nga din kasi ang problem with HPV vaccination, hindi siya ganun ka accessible kasi nga mahal. Pero when you look at it, of getting the cervical cancer, mas mahal yun. Mas mahal yung treatment. And then you have the cancer. So, might as well get the vaccine.
agree. This can be prevented. Sorry,
Yes.
did we just go back to what you said about the program about giving Gardasil? Because
Mm,
I've had patients kasi yung anak nila, they were given Gardasil, but it was stopped. The program was stopped because
well,
of
the
the
program was
tension.
stopped. Hindi, yung
And
yan nga,
other,
yung diba?
yeah, and they're thinking na it might promote promiscuity
Yes.
or mapusok na activities, but that's just sad. So, but if they have the opportunity, prevention is better. before any contact. Sige. Another question. Up to what age can we give the HPV vaccine? Suppose, Doctor, the patient already started sexual activities. Say a patient in her 30s. Do you still advise giving HPV vaccine? Because in theory, it should be given before
Or
any.
yes.
So how about the patient in her 30s or 40s? She's just afraid that she might get cervical cancer because she heard that a relative of hers got cervical cancer. What would you advise?
You can still get the vaccine. It does not actually only prevent the cervical. You have also the the prevention of the genital wart. So yun pa isa pa yun. And of course, we cannot the efficacy of the vaccine is not as good as if you were given before the sexual debut, but I think it can still help, although there's no study regarding that. Yung bibigay kami ng cervical vaccine na already with sexual or already in the late 30s with sexual activity na. So yeah, but you can still get the vaccine because, and then you also have to get screened, of course. So vaccination and screening. So regular screening actually also prevents cervical cancer kasi early detection of the precancerous lesion is actually good before actually going to if it before it progressed to cancer. So mahaba ang pag-develop ng cervical cancer. So that's why nga we're getting the cervical cancer usually falls at the 40s, 50s kasi mahaba yung time ng pag-develop ng cervical cancer. It takes 10 years, parang 10 to 15 years. So actually regular screening do help. There's
Sorry, yes, go ahead.
yes, with regards to HPV DNA testing, there's actually an ongoing program with DOH, NGPICO. That's the success program, but it's just starting in different hospitals. So it's being introduced, the HPV DNA testing, it's being introduced as a screening for cervical cancer. So yun, hopefully, marami kasi siyang center. So, alam ko meron sa Batangas, sa San Pedro, sa NCR, and marami pang tinitrain sa centers. Hopefully, you can join the study or that program. Kasi it's a free HPV DNA testing. The HPV DNA testing, if you would like to get that test, it's around 6,000 pesos. So medyo mahal siya. And that program is free. And what's good with the HPV DNA testing, you can collect your own specimen. So you don't have to go to a clinic or to a center to just to get the test. You can actually do the test on your own. The center or the program only teaches you how to collect the specimen. So yun yung maganda with HPV DNA testing. You can do your collection on your own. And hopefully sana ma-promote yung HPV DNA testing sa Philippines.
I mean, the patient, it's not similar to doing pap smear on
It's
your own.
parang the same, but you can't do pap smear on your own kasi di ba you have to get the
It
speculum,
was
do the
quite
test.
interesting how
But the
HPV DNA
HPV
samples should be
DNA
collected.
testing, you can there's a swab. You can insert the swab in your vagina. Parang there's tinuturuan namin how to self-collect. So parang papasok mo yung swab, when you feel parang it stops there, then you do the collection, you do the rotation of the swab, clockwise rotation for 10, and then that's it. You get the sample to be sent for HPV DNA testing. And
Okay.
what's good
I'm
because you can test the HPV 16. Sige, okay, go ahead.
I know, sorry, it's just an add-on question related to the previous question that was asked. So meaning to say, you mentioned that the time before a person actually has that obvious cervical cancer lesion, it might be 10 years, 15 years. So the
Yes.
latent time is actually quite long. Now
Mm-hmm.
there's a question here. Is it still prudent? Is it still practical to give the vaccine, let's say, if a patient is already 50 years old or 55 years
Actually,
old?
as I've mentioned, there's no hindi na nakasama kasi up to at 26 years old lang yung sinasabing efficacy ng virus. So kung 50, I think the most practical would be just to get screened. So you do your screening, your pap smear, and your HPV DNA testing rather than getting the vaccine. Baka hindi na kasi siya ganun ka-effective for that age.
Okay. How about because you mentioned screening. How about the recommendation, the actual recommendation? Because if we are, let's say, looking at other guidelines from other countries, there are um, there are statements there saying that you could have it done once every 3 years. And in the Philippines, we advise that the patient should have their pap smear once a year or annually. Can you comment on that?
Yes, actually WHO and yung ibang guidelines would recommend getting your pap smear or even your BIA every 3 years. But for the Philippines, since we have the high burden of the disease, we actually screen our patients every year kasi nga mataas yung burden ng disease natin eh. So to actually get the patient early, so yun yung recommendation is to get pap smear every 3 years for 3 years. I don't think kung na meron pang nilabas na guidelines na nag-change nito. Pero but that's what I still know. And then, yun, every 3 years. If we have the HPV DNA testing, the screening would be actually much less every 5 years. So, mas mahaba. Unless, pero iba pa, may triaging pa rin pala yung HPV DNA testing. Pero if it's negative, you can get the test after 5 years.
Okay. How the Jipego, tama ba? Did I pronounce it
Yes,
correctly? Jipego, sorry, has that program. If someone is interested, how do they get in touch with with anyone regarding that program?
It's just starting kasi. What I know, ang nagto-start pa lang ng screening is at San Pedro. So, malapit siya sa Santa Rosa. San Pedro, the Evangelista Medical Center. Yun pa lang alam kong doing the success or the scale of cervical cancer secondary prevention strategy. So, yun yung HPV DNA. You can actually go to Evangelista and inquire about the success program.
Okay. So hopefully if we get more details, let's say if it's more prevalent in other hospitals or institutions, you could give us a heads up so that
Yes,
those who might be interested
the Fed in getting
can avail of that very, very useful useful test. Regarding screening, the usual advice is to start at if I remember correctly, 21 years of age and above. And for those with sexual contact. So for those without any sexual contact, let's say she's already 35 years old, is it warranted to do pap smear? Because there are instances wherein a patient would have cervical cancer even without sexual contact.
Yes, the advice would be to start screening. Actually, the 21 is being changed now into 25 years old. So 25 na yung actually start ng screening. So if you have sexual earlier, you can start already screening. But if wala, you can actually start screening at 25 or at 30 years old. So if there's no sexual contact, you can actually start
Even with
screening.
even without sexual contact, Dr.
Yeah, I would advise screening at least 2 times, yun nga, you can start at 30 years old, and then if it's negative, then you can follow up after 5 years if you have the HPV DNA, or if you have the pap smear or the cytology every 3 years.
I see. For the audience, if you have any question, you may type it in the chat box. We still have some time. Meanwhile, I'm still scrambling for other questions that I'd be asking you, Doctora. So suppose they have suspicious cervix. Where can they have the cryotherapy that you mentioned? You said in some institutions. Is it readily
Um,
available, or can
yes,
it be done instead?
yes, there are centers already that have the cryotherapy. So may mga centers nga na trained for cryotherapy, but I am not aware of sinong centers. Pero the hospitals, the big hospitals, have cryotherapy, especially if they have a gyne-onco specialist there, or there's a cancer center in that hospital. There's cryotherapy. It's part of the treatment. So, yun.
Okay. There's a question here. Is there genetic predisposition in having cervical cancer? Can you say that a patient who had a relative with cervical cancer may also have a likelihood of getting one?
Um, Actually, based sa mga studies before, parang hindi not more of genetic yung cervical cancer, but then as we uh, as it has been there's an ongoing studies ganyan, they are seeing more na parang may genetic, or actually ang tawag nila doon is parang the genes, your genes have the uh, predilection in developing any type of cancer. So parang ganon siya na if your environment, your genes have the tendency to parang na magkaroon ka ng cancer, parang ganon. But cervical cancer that is hereditary is very rare. Parang I haven't heard of na merong ganon. Yun.
Okay. There's a question in the chat box, Doctor. Just asking about how much is HPV DNA testing.
So the HPV DNA testing in laboratories is around 6,000, 5,000 to 6,000. I'm not so sure sa price. Pero
Iba nga
parang more or
7,000
less
pa.
6,000 yung pwede mong magastos. Pero
More or
yun nga,
less. Could be 7
it's
or 8.
very, it's a high performance test nga. So parang you know na you have this infection, then you're more aware na you have to watch out, you have to get screened, you have to go to prevent progression to cervical cancer if you have the high risk type of HPV. And actually, you can get treated for that. Say if you have HPV 16, the new guideline says if you have an HPV 16, lalo na po with HPV DNA testing, pwede ka na kagad mag-treatment with cryotherapy or thermal ablation to prevent the progression of this
I see.
cervical
Even without
cancer.
actual lesion, as long
Yes,
as the patient, oh, that's interesting to
16 and
know.
18,
So,
yes, you can actually get treated.
okay. So sometimes it's not readily, I mean, any problem is not seen in the conventional pap smear. The conventional pap smear has low yield
Yes.
sometimes. So I guess
Mhm.
getting that HPV DNA would be beneficial if a patient deems herself high risk. Now,
Yes,
with
yes.
regards to screening, when do you stop? When do you advise a patient to stop doing screening?
So the guidelines now is that if you have already screened for quite 3 times and it's negative, um, you can stop at 50 years old. Yun yung new guideline. But yun nga, sa Philippines, parang up to 60 or 65 years old, you still get screened. Actually, sa ASCCP guidelines, which is what we follow sa Philippines, is actually you still have to get screened at 65 years old. Kasi may mga nakukuha pa kaming patients around 70 years old or 80 years old still develop cervical cancer. So up to 65, you still have to get screened. If hindi ka pa nakapag-screen before, ha? So you can still get screened
Mm,
at 65 years old.
I see. So do I understand it correctly? 65 years old, you can still screen the patient, but if the patient has had 3 consecutive negative pap smear
Mm,
results at
yes,
the age of 50,
pwede ka na mag-stop. Yes.
even with the burden of cervical cancer we have in the Philippines, it's
Yeah,
quite
yun
scary
nga din.
kasi.
It's quite
Uh,
scary nga kasi yun nga yung laging debate with regards kung sinong susunding guidelines sa US or
mm,
sa, kasi we have really a high burden of disease. So actually what we follow is the ASCCP guidelines, yung, which is 65. Pero yun nga, if kunwari, before 65 years old, if you have already screened yourself more than 3 times and you are already at 65 and it's still negative, then you can stop screening.
okay. We have a question here. What are the prerequisites or what preparations should be done before getting the HPV DNA testing?
Actually, wala naman except if you have menstruation. Parang,
If
or
sorry,
hindi,
sorry
hindi
po.
ako
If
sure,
you have what?
menstruation.
How about sexual contact? Because we advise our patients not to have sexual contact. Pag
No,
magpa-pap
it's
smear,
okay lang.
usually.
It's okay.
Okay.
So I
So no
think that
problem.
menstruation.
Sa bagay, it's already a PCR type of testing, so
Mhm.
they'll be able to get the specific segment needed for the DNA na HPV. Okay. We have no more questions in the chat box, but do you have any other points or statements you'd like to emphasize, Dr. Hurtado?
So I think that's everything that we discussed. So yun nga, may take-home message is get screened, get vaccinated. So cervical cancer is a very preventable disease. And if you do have, if you did get cervical cancer, the early diagnosis is important because it's really early. It's very treatable.
Okay. Thank you so much for that, Dr. Hurtado. Um, we now proceed with the closing remarks from our medical director, Dr. Lilibeth Maravilla. Dr. Maravilla.
Hi, good evening. Yes, thank you very much, Department of OB/GYN, for that very interesting lecture. Very informative indeed, kasi we have not thought of promoting these types of vaccine, especially for the young population, and of course the screening at a very young age. Well, literature says 21, but Dr. Hurtado says it's 25 now, and periodic screening. Siguro we have to strengthen then our promotion on these types of diseases, kasi these diseases are very much preventable, and these are the few types of cancer that are not significantly linked to genetic makeup of an individual. So this is from an infection, so really very much preventable. Of course, being clean, having safe sex, and having no risk factors that were mentioned were the best are the best factors to maintain for primary prevention. But apart from that, very important is having your children vaccinated at a very young age. So thank you very much for the very informative lecture tonight. And I want to thank Dr. Hurtado for that very comprehensive lecture. And of course, Dr. Rani Cadiz for moderating the session well. So a lot of informations were generated on the question and answer session. So very informative. So thank you very much, Dr. Hurtado and Dr. Hadis, for handling our OB, GYN. This is part of our ancillary series, both for our lay population and also for the of course, for the non-OBGYN doctors, because these are welcome informations for all of us. So thank you very much. Back to you, Rani.
Thank you very much, Dr. Manavilla, for that. And now we proceed to flashing the certificate.
Thank you very much, Dr. Cadiz and Dr. Hurtado. QualiMed Hospital Santa Rosa presents the certificate of appreciation to Dr. Mary Rani M. Cadiz for her expertise and valuable role as moderator during the webinar entitled Cervical Cancer, Be Aware, Don't Fear, given this 18th day of May 2022 via Zoom virtual event, signed by Attorney Nirmala Barbara S. Vanguardia, Chief Operating Officer, QualiMed Santa Rosa Hospital, and Dr. Lilibet Maravilla, Medical Director of QualiMed Hospital Santa Rosa. QualiMed Hospital Santa Rosa presents a certificate of appreciation to Dr. Reya Andrea H. Hurtado for her expertise and valuable role as speaker during the webinar entitled Cervical Cancer, Be Aware, Don't Fear, given this 18th day of May 2022 via Zoom virtual event, signed by Attorney Nirmala Barbara S. Vanguardia, Chief Operating Officer of QualiMed Hospital Santa Rosa, and Dr. Lilibet Maravilla, Medical Director of QualiMed Hospital Santa Rosa.
Okay. For better dissemination of information discussed in this lecture, a video recording of this webinar will be also posted in all official QualiMed Health Network Facebook groups and pages, and will also be uploaded in our YouTube channel. So if you'd like to review some of the pointers discussed by Dr. Hurtado, please visit qhn.tv. Again, thank you everyone for participating and joining us in tonight's webinar. That wraps up our webinar for tonight. Good night to all.